Who qualified for hair transplant surgery and when to start? Hair transplant surgery can be a lifeline for many people, providing boosts to confidence that would otherwise be impossible. But how do you know if you are a good candidate for this kind of surgery? You may be a candidate for hair transplant surgery if you have healthy hair growth at the back and sides of the head to serve as donor areas. Donor areas are the places on the head from which grafts and flaps are taken. Other factors, such as hair color, texture and waviness or curliness, may also affect the cosmetic result. There are several characteristics of the hair that may or may not make you a good candidate for a hair transplant. Hair color. Hair color is one of the biggest factors that will determine how effective the result is. This is due to the contrast between hair color and scalp color. The bigger the contrast between the two, the more obvious that balding appears. Those who have similar hair and skin color, e.g. dark skin and dark hair, or light skin and light hair, are less noticeably bald than those who have a high contrast between the two. This means that they are typically good candidates for hair transplantation. Hair density. Hair density is one of the biggest factors when determining who will be a good candidate for a transplant. Those who have good hair density tend to be good candidates for hair transplantation surgery. Specifically, surgeons will look for a good density of hair follicles around the donor areas of the scalp, that is, to say, the back of the head and the sides of the scalp. This is where the donor follicles are taken from that will then be used to cover any areas of balding. Hair texture. When looking at hair texture, those with curly or wavy hair can usually expect better results with less follicular units used. Afro-Caribbean hair is a great example of this. Hair thickness. Similarly to hair texture, hair thickness can determine whether or not a hair transplant will be successful. Those with thick hair require fewer drafts to get the same cosmetic effect as those with thinner hair. This is because the appearance of baldness is due to light penetrating past the hair and then being reflected off the scalp. Those with thicker hair will be able to block more of the light from being reflected off the scalp, resulting in a better cosmetic effect. Scalp flexibility. Scalp flexibility, also known as scalp laxity, is also something that is considered when determining suitability of a candidate for a hair transplant. If you have low laxity of the scalp, i.e. a tight scalp, then it will be more difficult to remove follicles from the scalp and transplant them, as opposed to someone who has high laxity, i.e. a loose scalp. It's important to consider all these factors together when determining whether someone is a good candidate or not. What is the best time to get a hair transplant surgery? There are some key factors that play the biggest role in determining the best time to get a hair transplant. These factors are: existing state hair loss. The existing state of your hair loss is important because it can help your hair transplant surgery team understand whether or not your hair loss is expected to continue or whether or not it has plateaued or slowed down to a significant extent. Hair transplant surgery is best done when your hair loss has slowed or is more or less over. Your age. There is no exact age required for hair transplant surgery. However, some hair loss experts recommend that hair transplant surgery be only performed on men who are over the age of 25 due to concerns regarding maturity and an understanding of the process. Harvest site. There is a finite amount of donor hair on your body. If you do not have a robust selection of donor hair, then your transplant team will need to be additionally careful in order to get the placement of the donor hair just right.